to our viewers at Sky Cable Channel 28, the Beautiful Heart Show. We will continue the management of a patient with hypertension. We know that one of the complications of hypertension would be to affect the heart. No? Some patients with chronic hypertension develop cardiomegaly, or their heart tend to enlarge, especially the left side of the heart. And at the same time, because of the atherosclerosis, some of these patients also develop ischemic heart disease. So part of the workup, or as part of a management plan for patients with hypertension, is to do an electrocardiogram, or what we call EKG or ECG electrocardiogram. We have a machine here, a portable electronic electrocardiogram, and basically you check the electrical impulses coming from the heart, and it is recorded in a piece of paper, and then you interpret that. We call this as 12-lead EKG, and the electrodes would be attached to the chest. No? There are about 12 electrodes, and you need kind of a conduction material here. So our patient should feel relaxed, no? Before you start the EKG. Make sure that there are no metals attached to the body, and of course you have to maintain a sense of privacy. You cover the patient with kind of a gown, and then you tell the patient to relax. No? It is a kind of a resting EKG. We called it resting dahil ang pasyente nakahiga. No? There is also that what we call a stress treadmill EKG, where the patient is attached to the EKG machine while they are doing treadmill exercise. It's a different way of getting ECG. This is what you call a resting EKG. So there are 12 electrodes. There are chest leads and limb leads. So first you attach this conducting material. So the first one, the lead, the V1 or your chest lead, should be the second intercostal space. No, 1, 2. So you attach that to your right, and then the second lead would be on the second intercostal space on the left side, at the level of the second intercostal space, and the third would be on the third, and the fourth is just like on the fifth midclavicular line. Fifth lead, 1, 2, 3, 4, 5. 1, 2, 3, 5 and 6. On the side. This is a 12-lead EKG, and you have 6 chest leads and 4 leads on the limbs. So you put one in here, you also put another one there, and in the lower limbs you put the extra electrode there. So all in all, you have a total of 12 electrodes. Now you connect, no, the electrodes. You notice this is color coded, and it will also tell you, right arm, left arm. So you put you can start with the limbs first. The 4 limb leads. Okay, locate that. So right arm, RA. No, the other side there.
Okay.
And the other one is right leg. And then left leg. Oh, this is left arm. So left leg. And then the V1, the chest leads, you gather them all together, kata.
V5.
No, you locate for the V1.
V1.
And then the V2 there, V3.
This is V2.
Make sure that the leads are not entangled, otherwise you will have a poor tracing later. Then V4 and then V5, V6 to the right.
V5. Then
Everything, check all the leads, if it's all connected.
V6. Okay.
On, and then auto print. Printing the we will make 2 copies for the patient. Okay. So this is the typical tracing of a 12-lead resting EKG. You notice you have lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, 5, V6. In the EKG, you need information, of course, patient. You have to take the patient's name, you record it, the age, the sex. Now in this EKG, because this is electronic and automatic, it will tell you right away the exact heartbeat, which is 72. Now you also take note of the height of the patient, the weight, the blood pressure, and the medicines that the patient is taking. Now some electronic EKG are interpreted by computerized way, but it is still best that the doctor who understands how to read an EKG reviews that computerized reading. In this case, we don't have the computerized reading, so we look at all the leads. No, apparently, the heart rate is normal. It says here 72. If you really check it, the heart rate is really within 70 to 75. Now, you also take note of the rhythm. The rate is 72, the rhythm, apparently in this EKG, the rhythm is sinus, it starts from the sinus node, and it is regular or normal rhythm. It's not, there's no arrhythmia, there's no irregular rhythm. And I don't see any signs of ischemia. There are no signs of ischemia. In other words, the patient does not have a poor supply to the heart muscle. The blood is flowing freely enough. Although there is a tendency that because maybe the hypertension is uncontrolled, no, there is a tendency that the heart is starting to enlarge. Not really. It's not really enlarged by ECG, but apparently towards that direction. No? There's a tendency for it to enlarge if you cannot control the blood pressure, the left side especially of the heart, the left ventricle. That's why it is best to control the blood pressure within the normal range to avoid left ventricular enlargement. Okay, so apparently this EKG tracing is almost within normal, no? Within normal range. There is no complication yet to the heart, but there is a tendency. If you cannot control the blood pressure, if you leave that blood pressure stay on the abnormal side, meaning to say it will continue to be on the hypertensive side, in a few years she will develop left ventricular enlargement.